Hi guys, today I want to talk about something slightly different than usual because today's topic is about psychiatry. You have to know that I am also a psychiatrist, so my next videos will be also about this argument. Specifically, today I want to talk about the difference between the obsessive thinking in the OCD and mind wandering in ADHD. They have some features in common, some overlapping features, and some differences. So, today's topic is about that. So, in order to talk about this topic, I created a couple of slides about the difference between mind wandering and obsessive thought. First off, we have to define the obsessive thinking, and we have to say that has some characteristics and some features that are partially overlapped to the mind wandering. One characteristic is that the thoughts are intrusive in the sense that they are not generated by the patient, but they pop into the mind of the person voluntarily, and they are also ego dystonic, so the experience is lived with suffering by the patient, because most of the times these kind of thoughts are not voluntarily generated, and they are not aligned with the morals and values and the way of thinking of the patient. They are repetitive, recurrent, and they cause a lot of anxiety. So we can see how these characteristics are also present in mind wandering, because the mind wandering of ADHD is also a kind of thoughts pop into the mind of the person without the consent, without being voluntarily generated. They are also intrusive. They are ego dystonic, so they are lived with suffering, and they are repetitive and recurrent. So, according to these characteristics, we don't see where the difference between the obsessive thoughts and mind wandering ADHD is, but there is a clear difference, and the difference is more in the content of the thoughts than in the way of rather than in the way of the presentation of the two conditions, because the content in the obsessive thought is, generally speaking, unique, and it has a continuation in the narrative. We can make an example of a person with a contamination obsession. He thinks that he's dirty and is contaminated, and this kind of obsession is unique. It's not overlapped with other kind of thoughts, and the patient has anxiety due to these thoughts, and it that then that those thoughts cause lots of anxiety in the person. So in order to relieve from this anxiety, the person behave compulsively to neutralize the obsessive thought. In ADHD, mind wandering is different, because we can more talk about frame of thoughts than complete and unique thoughts. So most of the times there is no continuation in the narrative of the intrusive thoughts pop into the mind of the person with ADHD. But there are more frames of thoughts and imageries that pop into the mind, distracting the person. In both cases, they cause anxiety and discomfort. But another difference is that in the obsessive compulsive disorder, the way to escape from this anxiety is to act compulsively, while in ADHD, what a person with ADHD does in order to escape from anxiety and to relieve this feeling is to act in a way to reduce and to stop this train of thoughts, and this fullness of thoughts in the mind, acting with a uh, having an immediate gratification. So is something leading to dependence, to behavioral dependencies, and to uh, addictions, basically. So we can say that the differences is not in the fact that they are intrusive, because both of them are, in the fact that they are ego dystonic, that they are repetitive. All uh, these two conditions have these features in common, but the differences are in the content that is unique in the obsessive compulsive disorder, and has a continuity in the narrative, while in ADHD, mind wandering is more of a fragmentation of thoughts and without clear narrative. And also the consequences, because in the obsessive thinking there is the compulsion as a way to relieve. Instead, in ADHD, the way of relieving from the train of thoughts is immediate gratification leading to addiction. So hope this can help.